Okay, so yesterday, class, we had our discussion with serotonin. It's our happy hormone, right? But aside from being a hormone, it can also act as neurotransmitter. At the same time, it can also act as local mediator. Therefore, if it is released in the cell, if local mediator siya, pag ma-release siya sa cell in a specific organ, right there and then, there is the receptor. It can bind to that receptor and automatically elicit its pharmacological action or its what do you call that, physiological action. So ganun yung ating serotonin. And what else? We have discussed that it is obtained from the amino acid tryptophan. That is why it is called 5-hydroxytryptamine. It is abbreviated as 5-HT. Now, just like the catecholamines, our catecholamines are the norepi, epi, and the dopamine. This also is metabolized and degraded by MAO or monoamine oxidase enzyme. Okay. However, unlike the other endogenous substances na na-discuss natin, serotonin has one of the most number of receptors in the body. So you need to be familiar with each one of them and their major location. But actually, most of them are found in the brain. But ano lang, different parts of the brain lang siya. Like 5-HT1A is found in the hippocampus. The 1B is in the substantia nigra. The 1E both 1E and 1F are found in the cortex, but the other one can also be found in the putamen, and 1F is on the hippocampus. Aside from the brain, we also have serotonin receptors in our gastrointestinal tract, like the 5-HT1P. And aside from the GIT, we also have receptors sa platelets nato. That is why one of the activity of serotonin is platelet aggregation. So I mean, it is involved in the formation of blood clot. Again, platelet aggregation. So yan, yung mga possible na mga locations of the serotonin receptors in the body. Now, our drugs can be agonist, but we also have antagonist of this serotonin receptors. And yun yung ating i-discuss this morning, the clinical pharmacology of our serotonin. Now, serotonin itself, class, actually has no clinical application as a drug. Unlike norepinephrine, epinephrine, dopamine, we have existing drugs in the market. And ginagamit sila for their own therapeutic uses. However, we don't have currently a serotonin na what do you call that, product in the market because again, it has no clinical application. Wala siyang clinical application nowadays. But what we have in the market again are agonists or antagonists of the serotonin receptors. So one example, let's start with the agonist ha. Iisa na to ang agonist and then later we'll have the antagonist. However, sila tanan agonist but they take action in different receptors. I mean, different serotonin receptors. For example, buspirone. In your discussion with Ma'am Cherry sa OrgMed nato sa PharmChem 2 nato, diba si Ma'am Cherry ang nag-discuss sa inyo sa anxiolytic, sedative, hypnotic. So included dito sa inyong discussion si buspirone. Now, ang mechanism of action ni buspirone is mag-activate siya og 5-HT1A, a specific na serotonin receptor. Now, once activated, ang effect ni buspirone is to calm the patient or mag-treat siya og anxiety. But this is a non-benzodiazepine na anxiolytic. Kasi most of our pampakalma class, mga benzodiazepines man, parehas anang diazepam, midazolam, alprazolam, yan yung binibigay natin sa patients with anxiety or insomnia kung gusto sila makatulog. But again, we have here buspirone, which is a non-benzodiazepine anxiolytic. And since it is not a benzodiazepine, meaning ana, lahi iyahang mechanism of action. Again, it's on the 5-HT1A receptor, agonist, si buspirone. And then, another drug na agonist sa ato ang serotonin receptor is the Dexfen Fluoramine. It is an agonist sa 5-HT or the serotonin receptor, especially in the 5-HT2C. So be careful ha, kay daghan kaayo ta og serotonin receptor no, and these drugs act on different types. So kailangan alam nyo na si buspirone sa 5-HT1A, si dexfenfluramine agonist siya sa 5-HT2C. Now, saan ginamit dati? Kasi this is now withdrawn from the market due to its toxicity. Si dexfenfluramine was once used as appetite suppressant for obesity and diabetes. Okay? So dati naatay anong class? Naatay appetite suppressant. Daghan magudtag appetite stimulant in the market, especially sa mga bata kung gusto nato sila patambukon, ginahatagan nato silang appetite stimulant. Pero we seldom see appetite suppressant in the market and most of them are being withdrawn. So appeal na din ha si dexfenfluramine. So agonist na siya sa 5-HT2C receptor in the central nervous system, which is responsible for appetite suppression para dili ka ganahan, di ka walay daghang cravings, di ka ganahan og kaon. But again, wala na ni siya sa market nowadays. So kung pangutanon ko ninyo unsa ang appetite suppressant nato sa market, I think si Butramine na lang ang nabilin, but I'm not that really sure. But you cannot purchase si Butramine without a prescription. It's a prescription drug because it's an analog of the amphetamine. So na siya effect on the CNS. Most of the appetite suppressant class sa CNS gyud ang iyahang target. Meaning ang imong appetite class na gyud sa utok tanan. It's your brain class that will dictate nga lami mo kaon og something. It's not always the stomach. Now, we are done discussing this one last time sa PCOL 1 when we discussed the anti-inflammatory, antipyretic, and analgesic. But nevertheless, let's just have a review about this since ang ilahang mechanism of action is on the 5-HT1D and 1B receptor. So again, this is agonist has a 5-HT1D and 1B. We call them the triptans, and the prototype drug for this, ang pinakaunang drug is the sumatriptan, which is almost exclusively used for migraine headache. Actually, these triptans are prophylaxis para dili magsigig migraine attack. So again, mahimo siyang drug for migraine. And triptan sila because their names end with triptan. Again, sumatriptan ang pinakauna. So we learned about migraine last time. Remember, migraine is one form of headache na pwedeng na ay aura, pwede siya kanang involving visual auras, pwedeng na ay visual scotomas or hemianopsia. Kanang hemianopsia is like, kung sa layman's term pa na, we call it blind spot. Kaya bitong imuhang mata nagtanaw kanon yun na ay mga blind spot na kay parts na dili makita. So, appeal na siya sa isa ka oras sa atuang migraine. And aside from the visual problems, syempre the nausea and vomiting is there. And sometimes there will be speech abnormalities for patients with migraine. And Take note, ang pinaka description ni migraine is unilateral. Severe throbbing, unilateral headache, isang side ng ulo mostly ang sakit, and it may last for few hours or pwede po siya pila ka adlaw. So that is our problem with migraine. Dugay siya mawala. Okay, and what is the nerve involved there for migraine? We have there the trigeminal nerve, which is an intracranial nerve, no? Appeal na dito sa ato ang cranial nerve, I mean. And that trigeminal nerve, it involves the trigeminal nerve distribution to intracranial arteries. Tapos, kana siya mag-release of peptide. Example, calcitonin gene-related peptide. Now, kana siya nga peptide is actually a vasodilator. So, muna akong ginaingon nga, pag magsakit inyuhang ulo, it means there is vasodilation sa mga blood vessels sa ato ang ulo, and that vasodilation will cause stretching of the pain receptors, mao na nga sakit. Okay? Mao ni siya ang problem nato with migraine. But we also have the so-called common migraine pero walay aura na face. Kanang aura gani kay kanang before magsakit imuhang ulo class kanang makabalo ka nga padulungay ka migraine kasi na kayo mga ma-experience like visually either mag-blurry imuhang pananaw or na kay makita din na ng mga lights mga star pwede na siya aura. And it will be followed by the headache. Pero again, we have common migraine nga. Magsakit lang imuhang ulo pero wala kay ma-experience na aura face. Yeah, actually, tama na siya, Isabel. Mag-warning ang migraine na maabot na siya. I also have this aura. Nakabalog yung ko nga padulungay na ko mag-migraine. Nga, muabutay na gyud ang sakit sa ulo. So usahay kung I need to function well, unahan na nako siyang tambal para dili na ko ma-feel ang sakit sa ulo. Okay? But be careful with a migraine because it may lead to kanang brain tumor basta pasagdan nimo siya. What do I mean pag pasagdan nimo siya? Ayun ninyo himuha class ang mga things nga kalaban sa Yes?
Ma'am, nang bad po daw, ma'am, pag i-tolerate ang headache, ma'am.
Yeah. Kung imuha lang siyang dala-dalaon.
Yes, daw po.
Yeah. Labi na basta migraine na siya, pwede gid siya mauwi into formation of brain tumor class. So, ayaw ninyo ayaw ninyo pasagde. Example sa migraine, di ba kalaban sa migraine magpulaw, ayaw mo sigpulaw, class mo sigmong pulaw, daghan mo himuon. Daghan og basta college student, daghan dyan nagbuhaton. Pero I hope you can manage your time na dili ma-sacrifice ang sleep. Aside from that, ang mga taong na migraine kabalo man ana dili dapat ta aside sa pulaw dili dapat ta magsigig kaon o pagkaon nga kalaban sad sa migraine. Samantong kalaban sa migraine, chocolate and kanang preservative rich foods. MSG. So again, iwasan na to na siya para walay daghang peptides na ma-release causing the vasodilation of the blood vessels in our head and then causing the migraine. Now, aside from the triptans, we also have other drugs for migraine Others will use ergot alkaloids pero kita dinhin na mga may migraine, we are thankful nga wala pa tani abot sa time nga mag-inom na tag triptans or ergot alkaloids. Most likely we use NSAIDs or other analgesic agents to treat the headache pero we don't really use Again, the triptans, ergot alkaloids. We don't even use the beta blockers, but actually beta blockers can be used for migraine, even the calcium channel blockers also. That is to relax our blood vessels. And then we have TCA and SSRIs, the tricyclic antidepressants, and the selective serotonin receptor. Selective serotonin reuptake inhibitors. That is for the serotonin itself, because remember, serotonin has an important role for migraine. And anti-seizure drugs are used for migraine since they also inhibit the excessive firing of the neurons. Remember, migraine involves the trigeminal nerve. And if that nerve is very active, nag-fire siya pirmi, pwede siya mag-cause of migraine. So, muna siya ang reason why anti-seizure drugs are used for migraine also. Again, to slow down the firing of the neurons. Now, mechanism of action, again, this is for the triptans. They are agonists, thus they activate the 5-HT1D1B receptors, especially in the trigeminal nerve endings, to inhibit the release of the vasodilating peptides. So this is true for both the triptans and actually the ergot alkaloids. So I think in my slide included po din si ergot alkaloids later. Now, we have here the triptans and the ergot alkaloids can actually act as a vasoconstrictor. When they activate the 5-HT receptor, this will lead to vasoconstriction. And that will actually treat the vasodilation and thus mawala imuhang headache or ang imuhang migraine. Because again, the vasodilation will cause stretching of the pain endings or pain ng mga receptors sa atuang ulo. Number 1 drug for the triptans is the sumatriptan. And ginagamit siya for acute migraine or pwede siya for cluster headache. That's another type of headache, right? The cluster headache. Kanang ang migraine is 1/2, ang cluster headache most likely dinhi kaning sa imong agtang padulong sa likod sa imuhang ulo kana ganing murag ginapuga ang imuhang ulo. So you can also use sumatriptan for this. So siya it can activate the serotonin receptor because the structure of our triptan is similar to serotonin. What is the problem with this? We have paresthesias, that is tingling sensation sa imuhang periphery. Murag ito ginatusok-tusok imuhang mga tudlo. Aside from dizziness and syempre coronary vasoconstriction. It can constrict the blood vessels in the head, but it can also constrict the blood vessels in the heart. Remember, kung inom kag tambal nga para sa sakit sa ulo, ang tambal dili lang siya makita sa imuhang ulo. It is being distributed all over the body. So it may also affect other blood vessels in your body, especially the coronary arteries. Pwede po niya siya i-constrict. So that is why be careful sa pag-take ng mga drugs. This is a prescription drug, so you cannot really buy this na over the counter. And then na-mention ko na ni Kagain na anti-seizure agents are used to slow down the firing of our nerves para dili po excessive ang atuang headache. And most of the time we use the NSAIDs and the analgesics and other analgesics to control the pain of migraine. Sige na inom ninyo pag mag-migraine mo. Specific drug na inyong ginainom. Kinsa may migraine dere? Isobel? Sige na himo nimo pong migraine kagang. Puro tong sadarang ko niya.
I-view mo.
I-view? Ako, okay ra ko sa okay ra ko sa paracetamol. Minsan paracetamol lang. Yeah. Okay pa man ang paracetamol. Pero iko ganahan og biogesic. Dugay kay mo talabs ko ang biogesic. I'm more on alvedon. I don't know what's in there. Pero parehas naman sila paracetamol, no? Kailan sila brand. Dugay kay mo talab ang biogesics ko ay. So dito ko sa alvedon. Pero there are times nga nagasaridon ko basta dili na gyud kaya ang kasakit. My problem with saridon is though it contains a little amount of caffeine, di ko katulog gihapon. Minom ko, labi na basta gabi ko minom og saridon, tabang ako dala stress. Siga akong mata imbis di ba nag-migraine ko, I want to sleep. Nawala ang sakit sa akong ulo, pero di ko katulog. Siguro kay wala jud na anad ako ang lawas o caffeine. Katulugan na. Headache lang. Mine is actually optical migraine. So it is related to my eyes. Mga bright guro sa mukha. I don't know. Dili po siguro. Mine is optical migraine kasi itong bata ko. Bata pa man ko. High school pa ko nag-migraine ako. Mahilig man ko magbasa nga kana bitawng nagahigda. Pag maghigda man ka magbasa so nagaana ka sa libro, matabunan syempre ang light and dulom mo pud nang nakaguba sa akong mata. Wow, sana all cup pwede ka katulugan na. Uy, parehas talay. Wag rin ka sa ako na. Actually, mas effective yun sa ako ang alvedon kaysa sa biogesic. Ambot ng biogesic, matalab na ako. Sa imuhang mata. Headache. Headache. Atik-atik na headache kay kaduha. Pero migraine is really different. Lamig kay bangga imong ulo sa nang iduk-duk-duk imuhang ulo sa simento. Actually, ma-relieve siya. But most of the time, basta dugay mo epekto ang drug, ginaana, dyan ako akong buhok. Ma-relieve siya pag ako ang buhok niya. One-sided lang maglagot ko kay dili pantay. Dili siya pantay. Pero nowadays, wala na kay ko naga-migraine. Dili mo kulang og tulog kay naara sa balay. Pero na ako'y mga cluster headache pag either going into menstruation na ay ka tingalaan ng magsakit gani kalit imong ulo class nga walay hinungdan. Pwede na siya, possible na siya na related siya sa imong menstrual cycle. Kanang padulong na ka menstruation na kay cluster headache, murag ginapuga imong, murag ito ginaipit imong ulo. So, pwede na siya, possible. Pero again, that is just cluster headache. Okay, and we are thankful no nga dili ta mo abot ani nga time. This is for refractory cases nang dili na gyud makaya mura mag cancer ani kay opioids are used for severe pain. Okay? Diha lang siya gamiton. Now, beta blockers, the tricyclic antidepressants, the calcium channel blockers, those that end with dipin or the verapamil, kung wala nag-end sa dipin, anticonvulsants or mga anti-seizure drugs like valproic acid and topiramate are also effective prophylaxis for migraine in some of our patients. They are used for prophylaxis para walay dili magsigig attack ang ilahang migraine, but kani sila ng mga drugs are not used during the attack. Again, they have no value in treatment of acute migraine during the attack. Kung feel nimo may migraine ka, sa asa na doktor, unsang klaseng doktor? Ano pang tana? I mean, unsang specialista? Okay. Actually, wala pa ko nakatry magpa-check up og migraine, but I think, let me check. I think okay pa rin naman sa internist. Kanang internal medicine. Or for others, kung grabe na yun ang ilahang migraine, I think they go to neurologist also. Pero again, mostly sa internist ramang good ta. Feel nimo na kay migraine. Feeling pa lang nimo dili pa ka sure kung migraine yun ba. Ano man, pain is actually subjective. So, klase-klase magutag na feel nga pain para sa kwa migraine. Pero there are some people na pag may migraine sila and then low ang ilahang threshold sa pain, sakit yun na kayo para sa ilahan. Then we cannot judge them kay mo gid na ang ilahang na feel. So na yung mga uban tao magud like ako taas kog pain threshold. Na yung mga sakit nga dili kay na siya sakit para sa ako. So kanya-kanya ta. Okay, and then we have the flunarizine, which is a calcium channel blocker used in Europe. And according sa clinical trials na mga results ani, this kind of CCB can also be effective in reducing the severity of the acute attack and prevention also. So ano siya, both treatment and prevention of migraine. So again, this is a calcium channel blocker used in Europe. Na-mention naman kanina, CCBs are also used in the prevention of migraine. And one CCB na ginagamit ana is the verapamil. So again, prophylaxis siya. Nga naman, 'di ba ang pag mayroon kag migraine, there is vasodilation. Pag nag-vasodilation, actually, there is relaxation here of the smooth muscle. And calcium channel blockers can actually relax the blood vessel. Remember, it can also cause vasodilation. So, bakit siya naging prophylaxis for migraine? Class, ang kaibahan sa headache ug sa migraine is, sa migraine na ay first vasoconstriction. Again, there is vasoconstriction, and then after there is rebound vasodilation. Una siya ang isa pud ka unique characteristic of migraine. So that is why verapamil and other calcium channel blockers are used in the prophylaxis to prevent this from happening, to prevent the vasoconstriction first before mag-rebound vasodilation. So para walay migraine attack. So actually kanang naga-vasoconstriction, dili nato ma-feel ang ginatawag na aura. So usa na siya mo dilate, musakit na kayo ang ato ang ulo. So i-prophylaxis nato, let's relax the blood vessels daan para dili siya mo contract, mo constrict siya and walay rebound vasodilation. Sa kanang good class, common nga headache. Sa common nga headache, diretso manggod na siya vasodilation. Dili na siya moagig vasoconstriction. So, pag rebound manggod nga vasodilation class, mas dako pag yun to nga pag-dilate compared sa normal na vasodilation na ato ang ma-experience sa common headache. Namo na ilahang kalahian. Okay? Questions so far about our triptans? Or our headache? Ano pa? Pero kung kaya sa paracetamol lang sa mo, that is our safest drug na analgesic. Okay, let's talk about other serotonin. We are still under sa serotonin agonist na ginagamit for clinical use. We have this one, the cisapride. Take note, asa siya agonist sa 5-HT4 receptor. And para asa siya, cisapride is actually for GERD or the gastroesophageal reflux disease and other motility disorders. Now, makakita na ba ko ani nga drug? I cannot remember. but this one is a very toxic one, so we don't really use this as a first line drug for gastrointestinal tract na mga sakit. But in the US, ginagamit siya as compassionate drug. Again, very toxic. So, ang ihang gamit lang is for compassionate uses. Mauna siyang gi-issue sa Food and Drug Administration for ivermectin. Diba, ivermectin is not until now accepted as a drug for the prevention and treatment of COVID-19. However, the Department of Health has issued CSP permit, compassionate na permit sa ivermectin for some hospitals in Luzon. Na ay pila ka buok nga hospitals, 4 to 5 hospitals in Luzon that were permitted to use ivermectin as compassionate drug for severe cases of COVID only. Severe cases lang ha. And at the same time, paghatagan kag CSP permit manggod sa DOH, pwede ang mga physicians dinha nga hospital maghatag ana nga tambal, pero given number 1, it's a severe case. Number 2, it's research. It's for research purposes. Therefore, they have to constantly monitor their patient na gihatagan og ivermectin, i-monitor ang effect sa tambal, and not just the effect, also the side effect. And they were asked to constantly report sa FDA for especially for untowards na mga effects sa drug. Okay? And also number 3, kalimutan ko. Kailangan po ang hospital na ay permit from the Food and Drug Administration to export. Not to export, to import. Sorry. To import drug sa other countries, because remember, we don't have the ivermectin na human grade as of now. All we have in the Philippines are animal grade na ivermectin. So kailangan nila mag-angkat og ivermectin sa uban nga bansa, so they have to apply an import drug importer na permit from the Food and Drug Administration. And aside from that, included sa permit na ang kanang nakabutang na the physician na naghatag or nagprescribe sa drug will be fully liable and responsible sa iyang patient. Mo nang ginatawag og compassionate drug. Ginahatag lang for severe cases. So si Cisapride, since it is very toxic, so naka-reserve na siya for severe cases of GERD or motility disorders na dili na gid makaya sa uban nga tambal. Okay? Questions? Wala. You have your study kay Ma'am Cherry sa public health. Sige siya pangutana sa kuha. Murag ipa-research mo natam niya. Apil sa inyong research na ng ivermectin. Okay. Next, we have the Tegacerod. This one naman is still an agonist in the 5-HT4, but this is just a partial agonist. Now, para asa po siya, this is used for irritable bowel syndrome with constipation. Thus, you can see there when you say 5-HT4, most likely this receptor is located in the gastrointestinal tract. Thus, the drugs used to stimulate or to activate these receptors are also used for GIT na mga condition. So for the case of Tegacerod, ginagamit siya for IBS, irritable bowel syndrome with constipation. Are you familiar with IBS? Anyone na familiar with the condition called IBS, irritable bowel syndrome? Wala. Wala, naka-familiarize what irritable bowel syndrome is. Yes, ma'am. Inyo to Isabel, ang ivermectin. Okay. Sige. Again, IBS or irritable bowel syndrome is actually a condition sa large intestine class, and it involves either diarrhea or constipation. Pwede diarrhea lang, pero pwede po diarrhea plus na apoy constipation. For example, karon nga week, they have diarrhea. Next week, they have constipation. And then the other na naman na week, diarrhea na naman. We call that again irritable bowel syndrome. So permi na siya sakit ilahang tiyan because nga there is abnormality in the motility of their large intestine. They also they have abdominal cramping. They also have the passage of gas. They have a lot of gas in their gastrointestinal tract, and the problem is they have to seek really medical attention if ever mag-involve na siya og pag-lose sa weight and naanay rectal bleeding. So magdugo na. I think I know someone na irritable bowel syndrome, and dili siya dili siya almoranas, pero makitaan nimo siya na puno nagdugo iyahang diri, lalaki siya, so dili siya almoranas, na siya irritable bowel syndrome. So magpass lang ang dugo, so dili siya kabalo. Okay? So we have the Tegacerod, can be used for IBS with constipation. And lastly, for our agonist is the melatonin receptor agonist called Rameltion. But this is specific again for melatonin receptor. However, melatonin, di ba, is from serotonin. In the pineal gland, especially at night, serotonin will become melatonin. Again, sa pineal gland sa atuang brain. That is our hormone of darkness. That is why it is involved in our circadian rhythm and our sleep patterns. So ang atuang agonist is the Rameltion, na ginagamit siya for insomnia. Ginagamit siya for patients that cannot sleep or have difficulty in sleeping. So those again are our drugs na agonist sa serotonin receptor. Now, questions before ta mag-move on sa ato ang antagonist na pod sa serotonin. Yeah, may melatonin na pills. We have the Sleep Well. Amo na ata siya ang pinakasikat na melatonin na pills. Sleep Well, it's over the counter. Yes, Isobel, na ginagamit for insomnia. However, ang label niya until now is food supplement. It's a food supplement containing melatonin. But for some people, it is really effective. It can still help them in sleeping. But since again, it's nagid na siya nakabutang sa iyang label na no approved therapeutic claim. So, the other expected na to class nga others will not really have the same effect. Naiuban nga dili gihapon sila makatulog even if they take the Sleep Well. So again, the brand name sa market for the pills sa melatonin is Sleep Well. But we have other brands. I'm not just familiar with the other brands. So if ever class, for example, you experience insomnia or your family members experience insomnia and you are looking for an over-the-counter drug to help them or to help you sleep, you can buy Sleep Well because it's an over-the-counter drug. Ang uban, pag dili na sila matablan sa Sleep Well, ang uban nagagamit na og antihistamine pwede cetirizine. Others would use the diphenhydramine or the Iterax. But please, again, be careful with using antihistamine to aid you in sleeping. Kaya remember, the first generation are also anti-muscarinic drugs. Mauga jud ka class, mauga na imong mata, imuhang baba, you will have dry mouth and all the other effects sa anti-muscarinic drugs. Well, our second generation antihistamine drugs like cetirizine can cause heart problems. So again, be careful sa pag-use ana para makatulog. Laguta sa sleep. Sleep well gyud ang iyahang ang iyahang brand. But for some people, milk is still effective because remember, milk is rich in tryptophan, and that tryptophan is converted into serotonin in the body, and in the pineal gland, serotonin is converted to melatonin. So again, milk is, for some people, still effective na pampatulog. Kung kanang tanan dili gihapon effective sa imuha, grabe na gyud na imuhang insomnia class. Sa daghan ka ginaisip, murag mag-insomnia gyud ka. So pwede mo mag-practice of meditation para makuha. Pero expected actually for college students nga guba og circadian rhythm. Kay daghan kaayo ginabuhat. Daghan pa ba gihapon mong paperworks until now? Fourth year na mo? Daghan pa? Ano subject ni ron? Hospital internship? Community internship? Akong subject? PCOL, QC? What else? Public health? Daghan mo gihapon ginahimo diha nga paperworks. Kapag ko nakahatag sa inyong assignment sa midterm ba? Nangita sa ako kanang worth researching na topic. So ni circadian rhythm sa muko mo kailag circadian rhythm. Inyong lawas wa kailag circadian rhythm. Anyway, pag maka-graduate na mo, you can practice sleeping regularly. Pero pag maestra mo ka, di ba, daghan kayo chikan. Next, serotonin receptor antagonist. So again, we are now sa mga drugs na antagonist sa serotonin receptor. So si serotonin mismo or the serotonin synthesis can be inhibited by the following drugs: the parachlorophenylalanin and the parachloroamphetamine. Actually, they are not considered as drugs. They are more, since they are toxic, pwede sila chemical substance, or to some extent they can be poisons. So ang pagka na siya mainom nato sa ato ang lawas, it will inhibit the synthesis of serotonin. But sa mga antagonists, sa mga receptors ni serotonin, we have the first one, phenoxybenzamine, which is, I believe, very familiar sa inyo ha. This is our alpha blocker na drug, together with phentolamine, used for pheochromocytoma. Diba, the condition na merong tumor sa adrenal medulla, and that tumor will release more epinephrine, and epinephrine causing hypertension to patient. However, aside from being an antagonist in the alpha receptors, the phenoxybenzamine can also block the 5-HT2 receptor, the serotonin 2 receptor. And just like its blocking activity sa alpha receptor, phenoxybenzamine has also a long duration of blocking effect sa receptor na. Pero again, asa ginagamit si phenoxybenzamine, it is used for pheochromocytoma. And then aside from that, we also have cyproheptadine, which is another 5-HT2 receptor blocker. But what is the use now of cyproheptadine? This is actually an antihistamine. It's a phenothiazine antihistamine. antihistamine drug. So antihistamine siya used for allergic reactions, but then it can also block the serotonin receptors. So remember class, atong mga drugs, naa sila kanang major receptor nga dito sila nag-act, so ginagamit sila for a certain condition, but they can also block other types of receptors, and that will explain their side effects. So appeal na din the antihistaminic na effect niya will be its use, na major use, and then ang iyahang 5-HT blocking actions can still be a pharmacological use, but to some extent, it can be considered as the reason of its side effects. But again, antihistamine man siya, so ginagamit siya for allergic reactions like cold-induced urticaria. But since it can inhibit the serotonin receptor, then it can also be used in the treatment of carcinoid tumor. So si carcinoid tumor class is actually syempre a tumor located sa atuang body. Most of the time it's in the lungs or in the stomach or in the gastrointestinal tract, and this tumor will release serotonin. So almost the same with pheochromocytoma na naay tumor, pero si pheochromocytoma naa sa adrenal medulla and ang gina-release kay norepinephrine. This time, si carcinoid tumor can be in the lungs or in the gastrointestinal tract, and ang gina-release kay serotonin. So since, again, cyproheptadine can inhibit the 5-HT2 receptor, it can be used in this condition, the carcinoid tumor. Okay, next we have the ketanserin, which is another antagonist in the 5-HT2 receptor. And sa effect ni ketanserin, if it inhibits that receptor, it will prevent the vasoconstriction and bronchospasm of carcinoid syndrome. So si ani ni siya, pag naay carcinoid tumor, mag-release na siya og serotonin. Let me write on the screen. Okay lang. Ay, nag-chat si ma'am. Carcinoid tumor, mag-release siya og serotonin. And most of the time, dili siya actually dayon ma-diagnose si carcinoid tumor kay wala man gud siya kaayoy kanang manifestation, signs and symptoms, because the liver is able to process this released serotonin. But ang atuang problem kapag ka maglala na ning tumor class, na siya sa iyahang terminal na stage, that is the time na the liver can also be affected, mag-metastasize na siya sa liver, and mahimo na siya syndrome. We call it carcinoid syndrome, where there is really manifestations of the signs and symptoms like vasoconstriction and bronchospasm, especially if the tumor is located in the lungs. So we have the drug here, ketanserin, to prevent those manifestations. So ketanserin can be used for hypertension, since it can prevent vasoconstriction, and again, it is used for carcinoid syndrome associated with carcinoid tumor. Okay? So the toxicity, syempre, hypotension. Wait lang. This one is an important thing. Let me just reply kay Ma'am Kesa sa finance. Okay, let's continue with another drug. We have the ritanserin, which is an antagonist sa 5-HT2 receptor. And para asa siya? Remember, the serotonin is an important na chemical in the clotting process or in the formation of blood clot or platelet aggregation. That is why napuntay drug for that kind of condition. We have the ritanserin that is reported to alter bleeding time and to reduce thromboxane formation. And that is probably via altering the platelet function. So, i-reduce na to ang thromboxane formation, thus ma-alter ang bleeding time sa ato ang patient. That is the use of ritanserin, which is an antagonist sa 5-HT2 receptor. And then another one, we have the ondansetron. Take note, asa siya antagonist sa 5-HT3 receptor. So, this one, among the cetrons na to, is the prototype. Pinakaunang cetron na inhibitor of that receptor. And para asa atong mga cetrons, ondansetron, granisetron, tanan nag-end sa citron class, ginagamit sila to prevent nausea and vomiting, especially if the patient is undergoing chemotherapy. So, di ba, ang atong mga chemotherapy drugs, they are very strong drugs. Most of the time after the chemo, the patient will really experience NNV, nausea and vomiting. Sigig suka ang ato ang patient. So, to inhibit that, to prevent that from happening, sa mga hospitals, ginahatagan ang ato ang patients og cetron. Any of the cetron will prevent the nausea and vomiting, and that they are inhibitors or antagonists at the 5-HT3 receptor. Okay? Questions so far about sa ato ang mga antagonists? Wala. So let's move on. I still have 15 minutes. Let's move on sa ergot alkaloids. Pag nadunggan ganina ninyong ergot, it is from, I believe I have already discussed this sa inyo, but this is from the fungi or the fungus called Claviceps purpurea. And asa nato na siya makita most of the time sa mga grass and grains nato, especially sa rye, under damp growing storage condition. So sa mga basa-basa na lugar. Actually ang fungi ganahan gid na siya kanang mga basa na lugar na naay moist, ganahan ang fungi ana. And mutubo na siya dito, especially sa mga grass and sa mga grains. But this fungus is actually very important pharmaceutically because we have a lot of drugs derived from Claviceps purpurea. Now, this fungus mismo, the fungus mismo can actually synthesize histamine, acetylcholine, tyramine, and other biologically active products. And ano siya, aside from this biologically active products, we have a lot of alkaloids also from this fungus na naay pharmacologic activity. But our problem, before ta mag-discuss sa mga specific na ergot alkaloids, our problem with these alkaloids is they can cause ergotism. Okay? Or ergotism, especially if kanang mga grass and grains that are infected with the Claviceps purpurea and then makaon gani na to makaon sa tao, mag-cause siya ergotism. And what are the manifestation of ergotism class? It can cause dementia with florid hallucination. So most likely na siya effect in the central nervous system. So be careful also of consuming kanang mga products, natural products nato class, labi na basta kung gidry na siya, dapat tama gyud ang pag-dry ana, kay kung mag-molds na gani na, di ba molds is a fungus, makaon nato. So again, pwede siya mag-cause of dementia with florid hallucinations. There will be prolonged vasospasm, and what will that unsay effect anang vasospasm, it may result to gangrene. Kailan ba mo gangrene? Unsay naong sa gangrene class? Mag-itom. Parehas gud anang sa mga diabetic patient pag masamad na sila, and since they have difficulty sa wound healing, kadugayan mamatay na ang tissues. and pag mamatay ang tissues, di ba mo itom? So maupod na siyang sa ergotism because it can cause vasospasm, it can cause prolonged na contraction of the blood vessel. So dili man good efficient ang blood flow, and if kulang ang blood flow for a certain tissue, it may cause the death of that tissue. So again, it will cause gangrene. So mag-itom na siya. It can be your hands or your feet, depende kung asa dapit ang vasospasm. And it can also stimulate the uterus for pregnant women, plus medyo lisod ni siya kasi it can cause abortion. So muna siya tanan ang effect ni ergot if accidentally ma-ingest, ma-consume nato ang either grass or grain that is infected with the claviceps purpurea. So other term for ergotism is Saint Anthony's fire. Again, mauna siya ang other name ni ergotism, Saint Anthony's fire. Now, mechanism of action, it can actually, the ergot alkaloids, I'm talking about the ergot alkaloids, they can actually act on a lot of receptors in the body. It can act on the alpha receptors, the dopamine receptors, and most of the time, the alkaloids that are important pharmaceutically act on serotonin receptors. But let's talk about the organ effects first. We have CNS selective. We have ergot alkaloids that are selective sa ilahang action in the central nervous system. And one of that is the lysergic acid diethylamide, which is abbreviated as LSD. Now, this is a synthetic ergot compound. Sa claviceps purpurea na fungus, daghan kayo na siyang alkaloid din na ato ang gina-isolate and ginahimo og drug for certain condition. But remember that we have the ability to copy this certain drug and make another one. So pwede ta maghimo og synthetic na drug. Mao na ilang gihimo class, lysergic acid diethylamide. Now this chemical substance is an agonist in the serotonin receptor, specifically in the 5-HT2. Again, agonist siya sa 5-HT2 receptor and at the same time in the dopamine receptor. But in the periphery, sa CNS manggod ng 5-HT2 na agonist siya class, pero sa periphery, sa imong kamot, sa imuhang tiil, sa imuhang lawas, LSD is an antagonist in the 5-HT2. Parehas na nga receptor kung sa CNS, agonist siya. Pero kung sa imuhang other parts of the body, it's antagonist. Now, unsay gamit ni LSD? Actually, none. Wala ni siya pharmaceutical use. But this is widely abused. Mura ni siya og marijuana because LSD is a hallucinogen. Actually, if you look at the list of the dangerous drugs, this one is the prohibited drugs. This one is included. Kasi abused parehas sa marijuana. Nga naman, ma-high sila. And just like the effect of marijuana, again na ay hallucination. Okay? Diba, ang shabu manggod is CNS stimulant, but the marijuana is more of a hallucinogen. So parehas silang effect ni LSD. So ang responsible actually is the inhibition of the agonist effect in the CNS na serotonin and dopamine receptor. Now, toxicity, there will be prolonged psychotic stage. Remember, there will be hallucination, and one of the symptoms sa schizophrenia and psychosis is hallucination, and there will be flashbacks. What do you mean by flashbacks? Murag murag movie ba mag-flashback ang mga experiences of long time ago. So may experience na siya sa patient na naka-LSD. Okay? So parehas sa mga abuse drugs, this one is also expensive. So ang mga addict na ginahanglan yun na sila og daghang kwarta para makapalit sa ilahang ginakaadikan. So dili lang marijuana and shabu. Marijuana ug shabu manggod ang pinaka gina-abuse, pinakasikat pero napatay daghan pa ng mga chemicals class nga gina-abuse pud nila. Okay? Now, bromocriptine, carbegoline, and pergolide have the highest selectivity for the pituitary dopamine receptors. Again, kani sila, they are also ergot derivatives. Aside sa LSD, kani sila bromocriptine, carbegoline, and pergolide are ergot derivatives also, but their action is more on the dopamine receptor. So that is why, if you can still remember, these drugs are used for Parkinson's disease. Again, this is used for Parkinson's disease. Next, we have vasoselective, meaning on the most likely on the blood vessel. Kasi humanata sa CNS, we only have LSD there and the drugs for Parkinson's disease. Ang vasoselective, we have here the ergotamine, which is a very common drug also. Sikat ni siya nga drug, ang ergotamine nga naman, ginagamit nato siya for migraine and cluster headache. Kasi remember its action is on the blood vessel. It's a partial agonist at 5-HT2 receptor and at the same time at the alpha receptor. So ano ni siya ha? Kanang alkaloid gikan sa Claviceps purpurea. Ang effect niya class kapag i-stimulate na niya ang 5-HT2 ug ang alpha receptor, syempre there will be marked smooth muscle contraction but blocks alpha agonist vasoconstriction. Our problem with headache, there will be vasodilation, and it means that the blood vessels are relaxing pero they are stretching the pain receptors or the pain nerve endings nato. But now, kung mugamit ang ergotamine, it can contract the blood vessel, and it means contraction means constriction. But since it has an effect on the alpha receptor, it can block the vasoconstricting activity of the alpha receptor. Side effect of our ergotamine, there will be prolonged vasospasm. Remember, it can contract the blood vessel, and aside from that, it can also contract the uterus. So this is not good for pregnant women kay makakos siya og abortion. Now, how do we use ergotamine for headache or migraine headache? Ginagamit siya during the prodrome of an attack. Sa pagsugod sa attack class, again, kanang nag-aura na gani ka, you can give the ergotamine to the patient. But ergotamine will become less effective if ma-delay. For example, full-blown na kaayo ang migraine, sakit na kayong ulo sa patient. Paghatagan pa nimo siya og ergotamine, the drug will be less effective. So, unsa ginahimo nila with ergotamine, we actually have a combination with caffeine for this. The brand name in the market is Cafergon. That is to facilitate the absorption and at the same time facilitate the action of ergotamine. Both of them can be used for migraine. But since this one is a toxic drug, we consider kasi the ergot alkaloids as toxic drug. Dili gid sila safe drug. The dose should not exceed 6 milligrams dose per attack and not more than 10 milligrams per week. So dili tap purag kaisa ra gyud ta ani makainom, dili pwede pasubrahan. So we also have dihydroergotamine, which is an analog of the ergotamine, but this is used by clinicians more than the ergotamine itself kasi mas stable ito and mas less na toxic. So ginagamit gihapon siya for intractable migraine, for severe migraine. And lastly, we have the methysergide, which is another analog of ergotamine that is used for migraine prophylaxis, but it is in the past lang. Karon you cannot see methysergide in the market anymore because just like the other na mga ergot alkaloids, this is also considered as toxic. So diha sa ako mag-end sa ako ang discussion because it's 10:27. We will continue next week with the uteroselective nato. Last man din. Di ako na lang ibuhuman ng class. Uteroselective last na ni Ergonovine. Brand name in the market is Ergotitrate. Ergotrate, which is a partial agonist at the 5-HT2 receptor and at the same time agonist pud sa alpha adrenoceptor. But parehas sila ni ergotamine. 'Di ba maupod na ang activity ni ergotamine, no? Kaya lang si ergotamine is more on the blood vessel, so para siya sa migraine. Now si ergonovine is more on the uterus. So uterus selective siya. So mo na nakabutang dira same with ergotamine pero na siya selectivity in the uterine smooth muscle. So clinical application, it can be given for postpartum bleeding, but it can also be given to migraine headache to some extent. Mas ginagamit lang si ergotamine. Nganong ginahatag siya for postpartum bleeding? Parehas sila og mechanism of action ni ergotamine. And ergotamine can cause vasoconstriction, 'di ba? Para sa headache. So kani siya class kung sa uterus pud ni siya, mag-cause pud siya vasoconstriction. And thus after pagpanganak class, kung nagani bleeding ang patient, pwede ihatag si ergonovine para mag-constrict and matabangan nato siya from the bleeding. Now, side effects, parehas lang sila sa ergotamine kasi again, parehas sila og mechanism of action. Now, we have an analog of ergonovine in the market and mauni siya ang mas ginagamit for bleeding, and that is the methyl ergonovine, or brand name in the market is Methergine. Actually, dili lang ni siya for postpartum na bleeding. Ang uban nga buntis ka ginatagaan ani for kanang premature contraction unya mag-bleeding ang babae. So pwede pud ni siya ihatag just to relax the uterus and to avoid the bleeding. So mani siya tanan ato ang mga ergot alkaloids, and that ends our discussion for chapter 16 na human ako class ang 116 nga slides ay 120 nga slides, so mag-quiz ta next Monday. Questions so far about the antihistamine and the serotonin. It's 10:30 na.